enemies, we're here with Dr. Jeff Mialis. Dr. Jeff Mialis is an assistant professor at the Departments of Orthopedic Surgery and Pediatrics. And if you could just, I guess, educate our parents exactly kind of what a concussion is, signs and symptoms. For every kicks parent out there, in layman's terms, what is a concussion and what causes a concussion?
Well, I think that's a great question because oftentimes I think there is still a lot of, even though we've been hearing more and more about concussion, there is a lot of misconceptions about what is a concussion, exactly what can cause a concussion. So, you know, I think in kind of easier to understand terms, maybe a concussion really is a shaking of the brain. And so the word to concuss actually means to shake violently. So what happens is the head stops moving suddenly, but the brain inside kind of jostles around. And it's that shaking of the brain that can cause a concussion. Now, every time that I turn my head, my brain kind of turns inside my skull. So not everything causes a concussion. Usually it's a blow to the head, or the head's, you know, whether the head strikes the ground, or the head strikes another player, or the head strikes a goalpost, like in soccer. These are classic mechanisms of getting a concussion. So again, the skull hits the goalpost, but the brain shakes inside the skull. And if it's enough of a shake, it will actually cause a concussion to happen. If it's a really significant shake, like think of a motor vehicle accident or a fall with skiing, you can actually shake it so hard that you tear some of the blood vessels. That's a whole nother level of a problem. So that's why a lot of times you'll hear the term mild traumatic brain injury, or MTBI. And a concussion is often called an MTBI because it's more mild than those severe cases. Yeah. But if you've had any player that's had a concussion, they can tell you that it doesn't feel mild when it happens to you. So I still prefer the term concussion. The symptoms of a concussion, so once you've shaken the brain and created that trauma, it usually presents with the same kind of typical symptoms. Now, they can vary depending on what part of the brain gets concussed. But the typical symptoms would be something like a headache, a persistent headache that's more generalized, vomiting or nausea, trouble seeing, and sometimes people report seeing a flash of light. Sometimes they actually have a lot of trouble looking at bright lights, and that makes the headache worse. Reading, like sometimes their vision's a little blurry. You can have changes in mood, and I often find this is a funny one. When I have football players or soccer players and they're crying on the sideline that they need to get back in, usually that's a sign for me that you're not going to go back in. This is probably a concussion. Yeah. You can have loss of consciousness, but loss of consciousness is actually very rare. Most concussions happen without a loss of consciousness. So the old thing 30 years ago about, well, he didn't lose consciousness, he didn't have a concussion, that's not true. 90% or more of concussions happen without loss of consciousness.
What would you say to kicks parents out there who, on the sidelines, say that, you know, sports have been played forever, and it's only now that we're hearing about concussions and concussion prevention? Why do you think that is?
That's a great question too. I think that kind of brings around this more general question of, are we really in a concussion epidemic? You know, a lot of people are describing this as an epidemic of concussions. There are no more concussions necessarily now than there used to be. With a little star after that, look at the bottom of the page. I do think that if you think about what causes a concussion, right, it's that trauma. Trauma is mass times acceleration. That's force. Not that everybody needs a physics lesson today, but kids today, I think, are bigger and faster than they were in the past. And I think this is true. You can look at it for soccer. When I have my soccer players that are in high school or college, a lot of these kids, to me, look like wrestlers. And they're soccer players. You know, there's just this. You know, we realize that weight training is not bad for you, right? We realize it doesn't stunt your growth. Those are kind of old wives' tales. So now what we hear is, now what we see is a lot more kids doing weight training, strength training. They're just getting bigger and faster at younger ages. So if you have bigger and faster athletes, you're going to have more force, so probably more concussions. So we might be seeing a little bit more. But I think in general, the reason that you're seeing so many more concussions or hearing about them is because we've gotten better at diagnosing them. And so now we know, and the general public knows, and coaches know, and that's all part of this concussion training too, is that more people know how to recognize a concussion, so we're going to be naturally diagnosing it.
Suspected concussion on the field. what would you recommend as coaches that we do?
You know, the first thing I'd like to address, if it's okay, is
Yeah.
the fact that I think a lot of people out there are probably even sitting here going, you know, I had a concussion when I was a kid. I'm
Yeah,
fine.
absolutely.
Like, I don't think these are that big of a deal. And actually, the truth is, you know what? In a way, they're kind of right. We're probably concussions. The good news about concussions is that the vast majority of them resolve, and they resolve without any incident. So chances are, even if your child suffers a concussion, they're going to be fine in the end. They are going to be fine. However, there is an important thing with concussions that when your brain is actually concussed, you're much more likely to, number one, sustain another concussion. Number two, sustain another injury, an ACL or an ankle sprain, because your balance is off and all sorts of things.
Yeah.
And number three, there are some really significant side effects that can happen if a concussion does not heal properly. One thing is actually called second impact syndrome, where the child could die with the second hit. And the other thing, which is much more common, is a prolongation of their symptoms. Their symptoms just take longer than the average to get better, and sometimes that can take weeks or months. So there is a reason why it's better to act on the side of safety and pull the child off, pull yourself off if you're playing and you think you got hit on the head and you might have a concussion. So how do you know if you have a concussion? I would say if you saw a hit to the head, if you know you got hit to the head, you know, if you see two players go up for a ball and they kind of collide with each other, and one's holding his head and like aching, or you know, saying that my head aches, my head hurts, or you know, you see her and she's complaining of dizziness or something like that, I think you have a hit and you have some symptoms, and it's better to pull them off, have them sit for 5 minutes. You know, if everything goes away in 5 minutes and they're feeling fine, well, not every hit to the head causes a concussion. But I think if you suspect a concussion, especially in a child, especially under the age of 18, we really need to not let that kid go back that day. It's just better to be safe than sorry. And you know, you don't want to end up with a problem. And it could be that one time, and that's a problem. So I think it's better to be safe than sorry.
This is an interesting one. How does the risk of a concussion in soccer compare to that of another sport, football?
So, well, I would have thought you, of all people, would know that soccer is football. But anyway, I think you're referring to American football.
American football, absolutely.
So, no, listen, I think, there is a little bit, some people say, well, I've seen some studies which show this and some studies which show that. And the problem with some of the studies is that, for example, a lot of studies don't have ice hockey included. And the reason is because if you look at a lot of studies looking at high school, for example, or middle school, hockey is not a sanctioned sport in the school. It's a club sport. So it's not going to be included in the same data set. So sometimes it's hard. You have to kind of tease through the data to figure out which sports you're comparing. You need to compare apples to apples. Overall, though, by far the highest risk sports are probably football and ice hockey. After that, it jumps down quite a bit. But then the next highest sports usually tend to be soccer, lacrosse, and usually basketball is tied in there. Interestingly enough, several studies have shown that girls in basketball, girls in soccer have a higher risk than boys for the same age, same sport. So girls soccer has a higher risk than boys soccer. Girls basketball has a higher risk than boys basketball. But if we're looking at soccer compared to other sports, football and hockey have the highest risk of concussion, and then it falls down to soccer. In general, girls soccer, women's soccer has a higher rate than boys or men's soccer. But they're kind of in the next tier.
What age do you think is safe to train kicks players the correct technique of heading the ball? And I'm saying the correct technique of heading the ball, not just heading the ball, but us training them to teach them the correct technique.
Okay. So in soccer, in general, the number one way you're going to get a concussion is by striking your head against another player going for a header. Or striking your head against the ground, or your head against an opponent's knee, or your head against the goalpost, right? The only real, I mean, there are fatalities in soccer, even in professional soccer, extremely rare, right? Sometimes there can be cardiac conditions, asthma attacks, whatever. In terms of head trauma, the number one way to die in a soccer match is with the goalpost falling on your head, which is why those goalposts need to be secured at the parks,
That's
right?
true. That law was enforced quite heavily just a few years ago.
And the reason it's enforced so much is because those are the fatalities. The fatalities are heavy goalposts falling on you and hitting you on the head. Mm-hmm. So let's be, very upfront is that soccer overall is a very safe sport, right? Mm-hmm. But concussions can happen. They usually happen if you're not expecting the hit. So this is where heading comes in, because heading is an interesting thing. When you see that ball coming towards you and you want to head the ball, you tighten up your neck muscles, you tighten up your core, and you lean into it, and you use your whole neck and body, upper body, as one unit.
Yes.
And so that dissipates a lot of the force, right? If I am not expecting the ball and the ball comes and hits me here, actually, if I just need a minute. I think I might have given myself a concussion. No, I'm kidding. If I'm not looking at the ball, now the ball hits me here, I am not having my neck muscles tight. I'm not engaging my core, and now my head is basically wobbling on this short little lever arm.
Yes.
So the key is the lever arm. If I'm heading the ball and I'm expecting it, I'm going to lean into it. I'm going to use my entire upper body as the lever arm. And so I'm going to dissipate a lot of that force. So most of the concussions in soccer, the vast majority, are going to happen when you're not expecting the hit. Mm-hmm. And so think of two people going up for a header. She's going up for the header, the opponent's going up for the header, and they are looking at the ball, but they don't see each other, and they hit heads. That's a very classic way of getting a concussion in soccer. Mm-hmm. So in terms of heading, a lot of people have started looking at this. Does heading the ball in general, could it be a risk for concussion, or what we are now calling subconcussive blows, which are blows to the head that might cause injury but don't result in an actual concussion with the full symptoms and everything. Mm-hmm. And to be honest, the jury's still out a little bit. There's a couple studies that have shown that, well, maybe there's a lingering effect, or and maybe the girls, there was one study done in girls that actually looked at just the number of times they headed in a season, and then looked at their performance on certain tasks, and found that the ones that headed the ball more in that season actually performed slightly lower on the tests. But there's so many confounding variables right now. Yeah. I think the bottom line for me is, I think overall soccer is a very safe sport. Mm-hmm. I think one thing that parents can do, especially when their kids get a little bit older, is neck strengthening. And I don't see, there's some studies that indicate it might have a benefit. We don't know enough about it yet to say it's going to prevent every concussion, but I really don't see a downside to strengthening your neck, and I see a potential upside.
Yes.
I do think proper heading technique, as you were talking about, which is a lot of probably what I was just talking about, which is ways to engage the neck muscles, ways to engage the core, mm-hmm. and make sure you're expecting that ball and leaning into that ball and using your whole body, not just your head. Yep. Usually we say around 10 years of age for heading. But again, that may change as more evidence comes to light, but I see right now the biggest things would be stay with 10, focus on proper technique and teaching how to head properly.
Yes.
And then we need to just let kids know that, listen, if you do hit heads with somebody, or the goalpost, or the ground, you need to come in and let us know if you're having a headache, or feeling dizzy, or feeling foggy, or any of those classic symptoms.
What are some of the misinformation out here regarding concussions? In misinformation?
Well, I think a little bit, I would say, to me, the concussion pendulum has almost swung a bit too far, and we need to get it somewhere in the middle. Yeah. So, I'm a concussion doctor. I see a lot of concussions, and that concussions are real, and I've seen cases where concussions go on for a long time, and I've seen some really bad side effects from concussions, and so I do think they need to be taken seriously. Mm-hmm. However, I've had patients come in telling me they looked at their iPad in bed and dropped it on their head, and now they have a concussion. No, you don't. Yeah. Not every hit to the head results in a concussion, So I do think that we need to kind of find this medium where we're taking them seriously, but we realize that not every little hit to the head causes a concussion, and we don't need to keep our kids wrapped in bubble wrap and not go out and actually live life because of a fear of concussion. So I think in general that we need to take them seriously. If you get hit on the head and you have any of those classic symptoms, it is better to be safe. Pull them out, you know, if they're still having symptoms after a day or two, bring them to a doctor so the doctor can evaluate them. If they're having any emergency signs that night, like vomiting, really significant changes in their behavior, their personality, they're hard to arouse, anything like that, they need, you know, worst headache of their life, they probably need to go to the emergency room that night. But I think in general, listen also to the clinician. If I say, listen, I think we need to wait a week or so for our symptoms to go away. Once they go away, we can slowly ease back into sport. They should do fine. Most concussions do.
Dr. Mianis, thank you so much for sitting down with us today and helping you know, educate us Kicks parents. If you're wanting to book a schedule an appointment with Dr. Mianis here, he can be reached on 312-432-2496. Brings me on to the last and most important part of the interview.
Real Madrid versus Barcelona, who am I predicting? Oh, no.
We are going to do, we're going to do a soccer trivia for you. If you get 2 out of the 3 correct, you win an official Kicks Parents jacket, okay? Are you ready?
I'm ready.
Okay. Name me one soccer player.
David Beckham.
English. Who won the first ever Soccer World Cup?
Brazil.
You ready? Who is this? Last one. You got to get this right.
All right.
Last question. What is the best youth soccer club in Chicago?
I would say Kicks United.
You got it!
Yeah!
Okay, you have just got yourself an official Kicks jacket.
Nice.
Right.
Thank you very much.